Pseudomyxoma peritonei, PMP, a detailed overview. Definition: Pseudomyxoma peritonei, PMP, is a rare, slow-growing cancer characterized by the accumulation of mucinous material, gelatinous fluid, in the peritoneal cavity. It is caused by the rupture of a mucin-producing tumor, often originating from the appendix or, less commonly, the ovaries, colon, or other abdominal organs. Pathophysiology: PMP originates from a mucinous tumor, most commonly a low-grade appendiceal mucinous neoplasm, LAMN. When the tumor ruptures, it spreads mucus-producing epithelial cells throughout the peritoneal cavity. These cells implant on the peritoneal surfaces and continue producing mucin, leading to progressive abdominal distension. Key characteristics of PMP: the tumor typically spreads within the peritoneal cavity but rarely invades other tissues or metastasizes outside the abdomen. The continuous production of mucin can cause compression of abdominal organs, leading to symptoms and complications. Causes: the most common causes of PMP include 1. Low-grade appendiceal mucinous neoplasms, LAMN, the primary source in the majority of cases. 2. Ovarian tumors, often secondary to metastasis from an appendiceal tumor. 3. Other gastrointestinal tumors, less common, but mucinous tumors in the colon, rectum, or pancreas may also contribute. Symptoms: PMP symptoms are nonspecific and often develop gradually as the disease progresses. 1. Abdominal distension, due to the accumulation of mucinous material. 2. Abdominal pain or discomfort. 3. Changes in bowel habits, such as constipation or bowel obstruction. 4. Unexplained weight gain or loss. 5. Hernias, sometimes presenting as inguinal or umbilical hernias. 6. Loss of appetite and nausea. Diagnosis: diagnosis is challenging due to the nonspecific nature of symptoms. Key diagnostic methods include 1. Imaging studies, CT scan, the primary imaging tool showing characteristic findings of mucinous deposits in the abdomen. MRI provides detailed imaging, especially for assessing soft tissue and fluid distribution. 2. Cytology and histology, analysis of acidic fluid or biopsies from suspected tumors confirms the presence of mucin-producing epithelial cells. 3. Tumor markers. Elevated levels of CEA, carcinoembryonic antigen, CA120 and CA19-9 may be observed but are not diagnostic. 4. Surgical exploration, often required for definitive diagnosis and to assess the extent of disease spread. Staging: PMP is staged using the Peritoneal Cancer Index, PCI, which assesses the extent of mucinous deposits in 13 abdominal regions. The prognosis correlates with the PCI score. Classification: PMP is classified based on histological features. 1. Low grade, disseminated peritoneal adenomucinosis, DPAM, indolent disease with better prognosis. 2. High grade, peritoneal mucinous carcinomatosis, PMCA, more aggressive with a worse prognosis. Treatment: management involves a combination of surgery and chemotherapy. 1. Cytoreductive surgery, CRS, also called debulking surgery. It aims to remove all visible tumor deposits. This may involve removal of affected organs like the appendix, part of the colon, ovaries, or even the spleen. 2. Hyperthermic intraperitoneal chemotherapy, IPEC. Heated chemotherapy is delivered directly into the peritoneal cavity during surgery. This treatment kills microscopic residual cancer cells and reduces recurrence. 3. Systemic chemotherapy, used in cases where CRS and HIPEC are not feasible or for high-grade PMP. 4. Supportive care, symptom management, including paracentesis to relieve ascites and nutritional support. Prognosis: the prognosis of PMP depends on histological grade. Low-grade PMP has a better prognosis compared to high-grade PMP. Extent of disease, PCI score. Lower scores correlate with better outcomes. Completeness of cytoreduction, CC score. Complete removal of visible disease improves survival. Survival rates. For low-grade PMP, 5-year survival rates range from 60% to 90%. For high-grade PMP, 5-year survival rates are approximately 20 to 50%. Complications: bowel obstruction, malnutrition, infection, psychological impact due to chronic illness, and disfigurement. Conclusion: Pseudomyxoma peritonei is a rare but serious condition that requires early detection and aggressive treatment to improve outcomes. Advances in CRS and HIPEC have significantly improved survival rates for patients with PMP. Multidisciplinary care involving surgeons, oncologists, and supportive specialists is essential for optimal management.